Hello, ARF.com. This is Dr. Stacey Wallach from Town & Country Veterinary Hospital in Town & Country, Missouri. Have you ever said to yourself, I really don't want to have to bring my cat to the hospital today because I know I'm going to have to get some medications to fix him, and I don't know how to give my cat medications? If that's you, I'm here to help. Today, we're going to talk about how to give your cat medications, the thing that nobody wants to ever have to do, but I'm going to try to make it a little bit easier for you. A lot of different things, okay? First of all, what kind of medication is your cat going to get? There are pills, there's liquids, and even better, nowadays we can get drugs compounded into a gel that you can actually just put on the inside of the cat's ears. Not all medications can be compounded like that, and not all of them are as effective like that, but talk to your veterinarian because believe it or not, that's a very good option for a lot of animals. So we're going to start by talking about how to give your cat a pill. So before we even show you actually how to do it, let's talk about our different options. So first of all, some people will take a pill and mash it and put it into something really, really flavorful to hopefully mask the taste. And some pills that'll work for, but there are some pills that are very fragrant, the cats really are bitter and they don't like it. As soon as they taste it, that's it. So you can try that, and if it doesn't work, so you replace that one pill that you had to throw out. Another option are greenie pill pockets. I am in love with this product. So what these products are is it is a little treat that has a hole in the middle of it. And what you do is you take your pill pocket with one hand and your pill, let me get my pill here, your pill in your other hand. And what you do is you take the pill from your one hand and put it right into the middle of your pill pocket. You never want to touch the pill pocket again with this finger because this finger has the smells of your pill on it. So then afterwards you just take this pill pocket and you can see how it'll just mash around that pill. And then you give it to your cat as a treat. And most cats will take this and swallow it whole and never even know there's a pill in it. Now some pills don't work for this. Maybe they're too big, or maybe your cats don't like treats. And if that was the case, then we move on to the next option. And I will show you that my cats will love these in a minute when we give them to them. Okay, so we're going to work on Aaron today. Aaron is one of the 3 cats that live in our hospital. And no, I did not pick Aaron because he's good about having a pill being given to him. None of my cats like pills being given to them. Some cats are a lot easier, and I'd say 80 to 90% of cats you can pill pretty easily if you know how to do it correctly. So there's a couple different things. First of all, you need to be able to restrain your cat, okay? So sometimes it's going to take more than one person. I, being that I've done this so many times, can do it by myself. But when you're just starting out at home, I would go ahead and restrain your animal in a certain position and then try it. And sometimes it takes 2 people. So a lot of times what I'll tell people is a towel works really well. The biggest problem that we have is cats will back away from you. So another thing that we do is we like to put our animals on the floor. Sometimes I think this is better so that they can't back up. What I will do is a lot of times I will put my animal into a corner where they can't back up. And I'm not sitting on them, although it will look that way. But a lot of times I'll just kneel over them, although Aaron is quite a big cat. But this allows him so he can't back up. I'm not putting any pressure on him. A towel, like we showed you before, wrapping them up will also prevent that. But I kind of like just doing this. And this way, I've got their face in front of me, and they cannot back away from me. So if you're by yourself, this is sometimes what you have to do. Now, if you're not by yourself, oh, come here, Aaron. Then you can have a second person just holding them from behind, like Anita here, my wonderful helper. And if you have a cat that's going to do paw like this at you every time you go with their face, then sometimes wrapping them in a towel so their arms cannot come out or the front legs cannot come out will work really well too. And then having the other person just kind of holding them like this. So you got to be able to prepare yourself for this. Some cats you don't need any of this. Some cats you can just go ahead and pill. But for cats that are more difficult, this is what you need. Now he probably does not need this, so I'm going to just have Anita kind of hold him so he doesn't come off the back of the table. The pilling process is kind of the difficult part, okay? What I tell people is you want to make this a pleasant experience. I give the animals lots of love before, lots of love after. The other thing to remember is if this is the only time you're picking your cat up and petting him during the day, they're going to figure it out very quickly that this is the time they're going to get a pill and they're going to already be trying to get away from you and not happy, just like when you pull the carrier out to take them to the vet. So what I do is I start by petting the cat. okay? And this just relaxes them and gets them used to me grabbing their face, because I'm going to. Cats have what's called the zygomatic arch, which is this bone that kind of goes around the eye and it connects kind of to the back of the ear. This is a great place to get control of my cat. I can lift their head straight up in the air by that bone. I can turn them left, I can right. I can actually lift the cat up by this if I wanted, but I don't recommend that. And then what I use my little pinky here as a pivot, and that just allows me to lift their head straight up in the air. Look what happens to their mouth. Notice how it automatically opens. The most important thing when you're pilling a cat is you don't take the pill and shove it into their mouth. Dogs, you can do that. Cats can bite you, okay? So more importantly with a cat, I like to just drop the pill into the back of the throat. So again, we are going to continue just by petting the cat's head. We're going to grab him by that zygomatic arch using my finger as a pivot, and I'm just going to kind of grab his head and lift it up towards the air. And when I do that, I can use my pinky of my other hand, and then I'm going to drop the pill. You want to drop it right down the hatch. Sometimes blowing in their nose or rubbing the top of the bottom of their throat will help them swallow. The important thing is that you don't let go at this point. If you let go, he's going to shake his head and spill the pill out. The other thing is you want to make sure they keep their mouth closed and up in the air until you actually see that swallow response. And when they swallow, then you can release everything. Okay? So, again, the important things to remember. Head straight up in the air, no fingers in the mouth, dropping the pill right down the center. If you drop it to one side or the other, they're going to spit it out. Right down the hatch. And then keep the head up, rubbing the neck until you actually see them swallow. Once you see them swallow, you can release. Then you're done. So here's that pill in the pill pocket. And you can see that Aaron here will really enjoy eating this. Here, Aaron. Look, you want the pill? You want your medicine? And just like that, it's gone. So easy. You didn't even have to touch your cat. It's great. So, for those that have a little bit of trouble with the whole hand pill, maybe we're just not as coordinated to do that, that's okay, because we have a pill doser. These work really well. One, it really prevents you from getting bitten. You're keeping your hands away from the mouth. You don't have to be as aggressive as holding the head up straight in the air. This is a very quick process. Cats don't seem to mind it. There's all different kinds of these. This is not just, there's ones that follow with water. I mean, there's a whole bunch of different options. This is just fine. So what you do is you have to load this. And all you do is you put the pill into the top. Once it's loaded, you can see how once you get this part to the back of the throat and you pop it, it will automatically go down. So poor Aaron is going to be our victim for this as well, and we're going to show you how to use this. So again, I still think that the same hold is good, but you don't have to be I'm going to do it the same way I always do. But for you, even if you were just to hold his mouth up like this, you can hold his head just like that and go into the corner. When you do this, you don't have to open the mouth and pry it. You can actually just shove it right into the back of the mouth, and they'll automatically open their mouth and kind of chew on it, and that's when you just pop it to the back of the throat. So again, holding the head up into the air, mouth opens, this goes to the back of the throat, and pop. So with this one, you don't need as much good aim with your fingers, because this one you can take this whole thing and go all the way down to the back of the throat. Whereas the other one, we were dropping it in, and again, if you miss to the left or the right, you're in trouble. This one will get it a lot further and more likely for him. You can see he swallowed much faster with that one. He swallowed, he's done, and he's a good boy. So again, make sure you praise them. Make sure they get a treat or something afterwards if they're allowed to. And make sure that the times that you're going to be doing this for that whole week, that you give them breaks. You enjoy them. You pet them all day long, not just during the time of having to give them a pill. So they're still going to love you and not hate you after you do this to them. So this is Alistair. Alistair's another one of our kitties that lives here. We are going to show you how to give a liquid medication. My preference, if you have an option between liquid and pill, once you get the technique down, I think pill, bar none, is the easiest thing to go with. Liquid, the problem with liquid is even if you get it all the way to the back of their mouth, they're likely to hypersalivate, spit some of it out, and you just never know if they get it. A pill, on the other hand, if they spit it out, you see it. Unless you let them go too quickly and they run to the back of the room and they spit it out behind your couch, which also happens. So make sure they swallow it. So, but if you have to, some medications only come in a liquid form. So if that's the case, you're pretty much using the same exact method as you are with the pill, except for with a syringe with liquid. The most important thing to remember is do it quick. You do not want to, like with kids, put it in the corner of their mouth and give a little bit and let them swallow it, and give a little more and let it swallow it, because the first time they taste it and they swallow it, you're not going to get near them again. So you get one chance only, usually with liquid. So again, we're going to use the same hand technique, and you're going to put this to the back, to the back of their throat, and just plunge the syringe in one quick motion. So same thing, petting the kitty, getting them ready. We're going to hold on to that zygomatic arch. Our pinky is going to pivot, and our head is going to go up. Same thing, you can either with your pinky, sometimes people will just do it with the syringe, but back of the mouth, squirt, and you're done. They don't usually always make that noise. And then when he swallows it, you're all done. It is not uncommon, even if you do the best application of the medication, they still will spit some of it out. They still will hypersalivate, especially the ones that taste really nasty. So even if you get all of it to the back of the throat in one swift motion, you're still going to get a little bit out. And some cats will continue to hypersalivate for a couple minutes. So stay there close with a paper towel and just wipe it as it comes out. There's nothing you can do about that. So in summary, don't be afraid to take your cat to the vet. Just because it needs medications doesn't mean you're going to fail. You can do it. It is not that hard to give your cat medication. Talk to your vet about the different options that medication comes in. Have them show you how to pill again if you're unsure. If at last resort, bring your cat to the vet every day, and I'm sure your veterinarian will do it for you. It shouldn't be that difficult. There's lots of different options out there. Just give it a try, and hopefully you'll succeed. Again, Dr. Wallach, Town and Country Veterinary Hospital. See you next time.